evening. Welcome to this month's Town Administrators Report. I'm David Watts Jr., and with me is our Town Administrator, Steve Mayo. Steve, welcome.
Thank you, David. But much rather be talking to you in the studio, but times being what they are, we are being cautious again, I guess.
We are. We're probably going to do the show this way for the next two shows at least. Hopefully we'll be back in the studio by March, but we'll see. But that's also going to be the subject this month. We've asked Anthony Choi, our health director, back. Welcome, Anthony.
Hi, thank you for having me.
And
Poor Anthony signed up at a great time, right, Anthony? He thought it was all over, right? The pandemic's over. And then,
oh, absolutely. But
Delta and Omicron hit.
That's what keeps our job interesting.
That's exactly right.
Just when we thought it was safe to go out and see people again. So, Anthony, we're taping this episode on January 19th of 2022. What are the current COVID stats for Wakefield and neighboring communities?
Sure. So currently, we're looking at Wakefield's case count. In the recent past weeks, we have seen kind of a sharp increase. And this is, this tracks with a lot of the data that we've been already seeing in other communities as well, with the Omicron surge, as well as the return from the holidays here. We've been seeing a lot of gathering. And so, as a result, we've been seeing a lot of cases. And so in the past couple of weeks, we have seen the average, increase quite a bit. So we were averaging around somewhere between 9 to 10 cases a week. And then recently we've seen, a pretty big jump. We're averaging about 73 new cases per day, or our average daily cases, 73 cases last week, and now we are back down to 41 for this week. And so, with the spike, we were anticipating, looking at data from other places, the Omicron kind of surge has increased, and we're expecting that we might be, at that peak or starting to go down the other side of it, right? And so we're hoping to see this trend continue. Currently, we have 924 active confirmed cases, and this, and I'll go back through in terms of explaining what this data really means for us at this stage of the pandemic. But just to cover a little bit more, our positivity rate currently in Wakefield is 20%, nearly 21% positivity rate. This is relatively high compared to what we were seeing before the holidays really kicked in. And so relative to the other communities around the area, we're on par, and we're seeing that these cases, has not extraordinarily hit Wakefield more than other communities. We're just seeing the trend kind of continue. Mm-hmm. I think one of the important things that we need to reiterate is that Wakefield's vaccination rate has been very high, for a while now, but it's improved steadily in most categories. And so we are over 80% vaccinated in a lot of the categories. Even in the most recently in the 12 to 15 group that was approved for the booster, even before the booster, we were at nearly 76% fully vaccinated. And so, we are seeing great vaccination rates. We continue to advocate for the booster because that's what provides, the highest protection against the new variants, as well as Delta, which is still a relevant variant, which is a predominant strain before Omicron really took over. And so I want to kind of explain some of the numbers that we're seeing in the average daily cases, as well as the total confirmed active cases. And really for folks to understand, how that informs some of our decision-making at the health department, as well as the town, right? So, ever since the holidays, it's been very difficult for folks to get the PCR. And so the PCR at the time was the gold standard, and it still is. It's still a very accurate test. But those results were automatically reported to the state. And so that's how we got the most accurate numbers at the time, when we received positive or negative results. Since the holidays and kind of the, large influx of antigen at home tests for individuals to take, those results there's no way for them to be input into the state database. And so the data that we're seeing right now are strictly PCR tests. And so while those are still happening, we are still trying to get a better handle as well, as well as the rest of the state of what the numbers actually look like. And so we might be seeing a decrease currently right now of average daily cases. This only includes those that test by PCR. We've been hearing many reports of positive antigen tests at home. And we've been advocating for, with the new CDC isolation guidelines to provide that information to folks that they should isolate for 5 days, continue to wear a mask for 5 days afterwards around others. But those numbers of at-home antigen tests are not being captured by our current data. And so really, to some extent, we are providing an undercount of the real cases.
And that actually
would go
brings up,
everywhere. Yeah. That would go
Yeah.
everywhere, though.
Yes,
True.
that is correct.
but that actually brings up a follow-up question. Over this last weekend, several news organizations began reporting that the present COVID surge has, in appearance at least, peaked and begun to diminish in Massachusetts, Connecticut, Rhode Island, New York, and New Jersey. Is this largely because of what you were pointing out just now, that so many more people are getting the antigen test as opposed to the PCR test?
Right. So, we're gonna only operate on the information that we can actually get our hands on, right? And so we know for a fact that there's going to be an undercount, so that will play a role. And I think that has contributed to some of the decrease in numbers. Not to say that there is not a true decrease in Omicron and just COVID cases in general. I think that if we're going off of the models that have been generated based on past exposures and models based on past experiences. We are seeing that we should be at that point where we're seeing a decrease based on number of infections that have already been in the community as well as the vaccination rate, right? So I think it's a combination of factors. I think it's the data that we're able to collect has changed over time due to the antigen test, but also I think that there is probably a decrease in Omicron cases as well.
But I think you also need to look at the hospitalizations, and they, in the last few days, seem to be coming down, but who knows? I mean,
But the other side of the hospitalizations too is that largely, and correct me if I'm wrong, but it seems as though most of the hospitalizations are people who have not been vaccinated for one reason or another, as opposed to the larger population that we saw a year ago, for instance.
Right, and so we are seeing, a large majority of cases that are hospitalized due to COVID are truly those that have been unvaccinated, right? So they don't have any doses of the vaccine. The next group that we've been seeing are the breakthrough cases, but those are individuals that may have their 2 shots, but are well outside of their 5 months since their last shot. And so that's part of the recommendation, that we've been putting out there is that, you may have the 2 shots, but to be fully vaccinated up to date, according to the CDC information, is that you should have their booster, and that will help provide the most protection. So those hospitalizations, I think we have to kind of look at the data both from the COVID side as well as, who is actually in the hospitalization in the ICU beds. And so we've been seeing with COVID, lots of folks are pushing off, elective surgeries, and that's due to the capacity of the hospitals. And so we've been seeing a lot of folks coming in now for their treatment, right? But either way, when we have both, a surge in COVID causing hospitalizations and folks that need essential services, I think what's going to happen is that we're going to see, the numbers being driven up in hospitalization percentage, and then that's what is going to strain our system.
One of the best things to happen this fall was opening up vaccinations to young people, between 6 and 18. And how has that affected what's going on in the schools at the moment?
So the vaccinations for the school, for school-age children has been absolutely essential to keeping both them in school, but also protecting them, right? And what I will say is Wakefield schools, school nurses, the administration, all the teachers, everybody involved, from top to bottom has been absolutely great in terms of handling, the situation. And so with our high vaccination rates in these groups, we've been able to keep a lot of these cases that could turn into more symptomatic cases, most likely to be asymptomatic, right? And so that's helped us limit the spread. a lot of the mitigation methods within the school. So that's all the testing programs that they do, all the school nurses do to mitigate, the spread in terms of making sure the symptomatic students are not left in the classroom. I would say that and the vaccination rate has really kept our community safe.
And I think we were fortunate enough, and Anthony and his team did a fabulous job holding local vaccination clinics for children. And I got to say, what a heartwarming day the 2 days it was to seeing the young kids come in. Very scared the first day, a lot of them were, but the second time around, they were all pretty good. I think they were fine. We had, was it Sammy, our police department dog there?
Yes.
And that really was a big hit with the kids. And you could see Wakefield's vaccination rate for that age group double because of the efforts of the health department. And that was fabulous. And
Right.
whole families coming in. And like Anthony said, it made a huge difference. Kids staying in schools, getting the education, families feeling better. A lot of this was right before Christmas. So people felt much safer because now their children were vaccinated and, they could get together with family and friends and feel a little safer. But what a great job. And, a lot of fun to be there, I got to say.
Of course, the other thing that has come up in the last 2 weeks, and there are people who are not happy with it. I will go on record as saying that I'm not one of them. I think it was a great decision, and that's the return of the mask mandate in town.
Yes. So in terms of the mask mandate, and I think one of the things I want to make sure that I put out there is that I'm glad that Wakefield's a very passionate town, right? I mean, they really do care about the policies that are being put in place, and they do voice their concerns when it comes to this thing. So I want to make sure that we don't forget that this is part of it, right? We want to hear about what the town has to say about all these policies that affect them on a day-to-day basis. But for the mask mandate, one of the messages that I really wanted to get across, was that it is just a tool in the toolbox, right? And we've heard this many times. It is just one of the mitigation techniques. And I would say Wakefield in general, even before the mask mandate, I've heard anecdotally at least that lots of people have been really good about wearing a mask inside, indoors and in businesses, and they practice social distancing. I think one of the things that we want to make sure we're doing is that we're utilizing all the tools that we have, to protect individuals from spreading and getting COVID. One of the things that we really pointed to was that there is very strong evidence. It's just that proper mask wearing, and the appropriate masks does mitigate spread. And so what we've been talking about is a strong recommendation to use, the surgical 3-ply masks, to use N95s and use KN95s. Those are the masks that have been approved, and those are the masks that really help mitigate spread. And part of the messaging to businesses as well as the general community has been that cloth masks, it's true, cloth masks do not mitigate the spread as well as the other masks. And so what we've been really pushing is for people to understand that if they're able to work with us on a short-term basis, right? This is just, as a limited time mask mandate we're going to review at a very soon date. What we want to make sure is that individuals know that once we have this surge kind of contained and we've come back down on the other side in terms of cases, the mask mandate will no longer be necessary. We're going to reevaluate the data, and so it won't be indefinite. And I think one of the things we want to make sure people understand is that we're keeping this, keeping a close eye on the data, keeping a close eye on hospitalizations, and making sure that we don't overwhelm our systems.
Actually, if I understand it right, the mandate is going to be reviewed by the Board of Health middle of March.
That is correct. And so we're going to have a review date then. We're going to look at the data in terms of, how many cases we're seeing, where the spread is happening, and if the mask mandate is necessary, because we're going to have, different vaccination rates at that point. The booster will have had more time in the community. And so we're going to reevaluate the mask mandate to see if it's necessary anymore.
And looking ahead, Steve, I assume that we're going to look toward doing the hybrid town meeting for annual in May.
Well, actually, it will be April 30th, I think will be the date, but it's close enough. I would love to think that we could get back to the Galvin for that day. I think we found in November, we did not have a lot of people outside. I think you know better than anybody else, David.
I had two.
I think that we can provide a lot more room. There are spaces that we could really spread out in the auditorium, in the Galvin. We have the big screen behind that we could, we've had great success with the closed captioning, really helped people that had some hearing issues last year. And I think that would be even bigger and better on that bigger screen on the stage. So we'll be reviewing that and, watching the cases very carefully. It is a little bit more comfortable setting. We don't have to set it up and set it down and, disrupt the students as much, which does happen because we have to be there, take a Friday to set that up. It's an all-day event.
Right.
So we'll be reviewing that. We can certainly pivot if we need to. I'm hopeful that by then we will, if things follow suit as we hope, right? We hope that the spike went up and the spike came down. So, let's hope that happens. But at this point, that's what my hope is.
Yeah.
Got a little bit of time.
Well, that's true. But, the other side of it is that annual town meeting tends to draw more people than regular town meeting does.
Tends to, yes, but we've got a big facility still. So.
Right.
Yeah.
Right.
Yeah.
What else are the health department going to be looking at, Anthony, as we go down the road over the next 1, 2, 3 months?
Sure. So in terms of, is this in terms of COVID? Because we can.
In terms of COVID, and then let's pivot to other health concerns in Wakefield over the next 4, 5, 6 months.
Okay, that sounds good. So I'll wrap up COVID here. So in terms of the next couple of months, one of the things we're going to do is we're going to we've been working very closely with the schools. We want to make sure that we're capturing all the data in terms of testing, in terms of vaccination rates, and really, move along with what the state has been providing us, right? And so in the past few days, in the past few weeks, there's been a lot of changes with the Department of Education and Secondary Education. And so they've been giving us a lot of different guidances, and really we're transitioning to a model of testing that, puts the responsibility some on on families, right? They're going to be doing some testing at home. There's going to be test kits provided. And so I believe that in the coming weeks and in the coming months, there's going to be a slight transition in the number of tests we're doing. And so we're going to be looking closely at the data to make sure that our data is accurately capturing that picture. And as well, we're going to have a mask mandate review in March. So we're going to make sure we're keeping track of that. And speaking of which, in terms of other things besides COVID, because we have a lot of other stuff to work on, a lot of things have been put on hold. So one of the things that we want to focus on is substance use and mental health, right? And those are things that our department has been working tirelessly on. We have a great staff that really work together with community partners to bring this together. What comes to mind is the youth action teams and the Wake Up Coalition. These groups have been working, nonstop, throughout COVID to make sure that there are, systems in place for students that are struggling, right? And for students as well as parents and general community members, this has been a stressful time, and a lot of issues have possibly fallen by the wayside. And so we want to make sure that we're addressing a lot of these programs. And so a lot of these programs that we're working with right now are looking for ways to really expand their services, really to, make sure that all of our students and parents are aware of the services provided and, what we can really tap into. And so in the next couple of months, what we're hoping to do is we're hoping to look at, some of the services that the health department can provide, and really identify some of the community partners that really fill some of those gaps. And so I think one of the things that we're hoping to do is just looking at the school environment to see what supports the schools will need, right? We're going to work with them to see, what they're identifying as their priorities, and then what we can do to support them.
Mhm.
I think that one thing that we, among many of the things we learned, with the whole last couple of years through COVID, is that any social well-being issues, from anxiety to substance abuse, really were exacerbated during the pandemic. And Wakefield has been, as a community, very supportive of supporting, economically, these types of services. Whether we had the um, interface service with the schools we started, we have a recovery coach through the police department, we have family services officers, we have the youth action team, Wake Up. We really need to provide more. Counselors in training, we've had social workers. So I think that when you're going to hear about that during this budget season, that this is one area that we really need to increase, really to keep us ahead of the curve. I remember 10 plus years ago when we started this program, maybe even longer now, maybe it's 15 years ago when we started this program. And no one else was doing it around us. We see it being emulated now, and we need to take that to the next level. And something I'm very proud of, and I know that Anthony is very proud of where our department is now, but it really, you would be surprised at the number of families that in Wakefield that are affected in these areas. And I think you're going to hear a lot more about, enhancing those services and partnerships with different providers. And really, when you hear about some of the success stories we've had, we need to do a lot more here. We're very fortunate that we have a health department that's got the bones in place,
Right.
police department, and we need to add some more meat on those bones. Now, when Anthony brings that up during the budget process, I'm going to deny I said any of that, because you know how I am.
Yes, but you're on tape now.
I'm on tape. I can't deny it. But this is a priority.
It'll be on YouTube, and anyone can pull it up. And
That's
just
right.
take- yeah.
But
So-
Oh, I was gonna put you on the spot there, Steve.
so and we do have the ability, thank God, to phase in what we need to do. And we've got a great team in place. So I'm very happy to be part of it. And you'll hear more about this in the coming few months.
Well, and we've talked in past shows about the what the police department has done to enhance those services
Yeah.
over the last decade and a half. And having the health department as a partner in this really makes it easier, I hope, for those families and those individuals that need the services.
No, I agree. And when you hear the success stories that, have occurred because of the follow-up, because of that, we have social workers going out. When you hear that people that need help are coming to the police station before something occurs, saying, geez, I'm feeling off today. I need some help. It really, it really makes a difference for the entire community. And, having a well-trained police force in this area, we've been fortunate enough to fund it. The town council has been great. Town meeting has been great. And, we need to give some more resources, because that issue is not going to go away.
Right.
And, we discovered that years ago, and we need to enhance those services. So happy to be there for the next round. Absolutely.
Well, and in some respects, having that in place before the pandemic hit has been an asset to the town too.
Oh, absolutely. Absolutely. I think years ago, people thought a health department was, they inspected the restaurants once a year. That was it, and investigated if someone had, chickens, right? It's not what, that's not what happens anymore.
No.
They do those things too, but that's not the mainstay in these days.
And I think people are learning that, and we're lucky to have Anthony with us now. In light of his background in epidemiology.
Right.
Yeah. I mean, one of the things, one of the things that we've tried to make a priority, and it actually was, slightly made easier in terms of COVID, was that it's emphasized the importance of, of good data collection, right? Really understanding how to communicate that data into something actionable, right? And so, we can report on numbers as much as we want, but for the public to really understand the impact of this data and what we should be doing with it, I think it's kind of a culture setting thing. Basically, now within our department, there's a great understanding, and everyone has embraced using that data to really inform on the next steps and planning. So
Yes, science is important.
Yes, it is.
One thing I do want to mention before we hit the end of the show is, and it was announced yesterday, I believe, by the governor, the free at home COVID-19 tests. For anyone who's interested in that, go to www.covidtests.gov. And once you sign up for those, they will ship via the post office in 7 to 12 days. And I think it's 4 per address.
4 per house, 4 per household,
4 per household,
4
yeah.
per address. Yep.
Right.
And now that's initially, will there be the ability to go out and order another 4, say in a month or something? How is that going to work, Anthony?
So from my understanding, it looks like there's going to be a combination of this 4 free tests as well as working with health insurance. So it looks like for every month, you will be able to order up to or purchase up to 8 at-home tests from approved providers if you have insurance, and they will reimburse you for it. And so it looks like, for us, you will be able to order the 4 tests and possibly the next month be able to reorder another 4 for each household. But this will be done in combination with the 8 tests at home tests per month that everybody on insurance will be able to take advantage of.
And the at-home tests have actually been fairly popular. I know several weeks ago in Walgreens and CVS here in town, they would get a shipment in and they would be gone within an hour or so.
Yes, I think the at-home test provides a lot of utility in terms of really determining not necessarily if you're infected, because if you test too early in the cycle, you may not have a high enough viral load to catch it. But really, it's doing the important piece, which is when you test and you do it correctly, it will be able to tell you if you are infectious and if you're still at risk of spreading the virus, right?
Mhm.
And so that's really what we're hoping to do, is have individuals understand that if they're still, at the chance of shedding virus, try to isolate, continue to keep yourself away from others so that you're not putting others at risk.
Mm-hmm, mm-hmm.
Right. Yeah, I think that the key is to contain this and use all the tools in the toolbox, as Anthony said.
Right, right. And just to be patient, it will end.
We
It
hope.
will end. It will take time, but it will end.
Yes, and I just want to stress that I think since the last time I was here, it feels like an eternity ago now.
It was only September.
It's only September, right? But I will say we are in a different spot than we were last time we talked. And so, it's important to understand that just because we have mitigations like the mask mandate in place, just because we are still talking about vaccination, it's not that we're in the same spot. We have a lot of these tools already in place to keep us safe. And so I think that there is there's light at the end of the tunnel here. We do see the end posts. And so as long as we keep being responsible, working towards this goal as a community, I think we will be out of the woods sooner rather than later.
And I think that's a great place for us to wrap it up here. Anthony, thank you for joining us again.
Thank you,
And thank you
Anthony.
for the information. Steve,
Thank you so much.
as always,
Thank you, David. Thank you. Everyone have a great night and stay safe.
absolutely. Thank you. We'll see you
Thank
next
you.
month.